Hi, aloha. So, would just like to welcome all of you. Thanks for joining in again today. And today I'm doing something that I don't really like that much, which is talking about myself. But I felt if I'm going to be invited into your virtual living rooms, you might want to know a bit about who I am and what I stand for. So, at the end, I'll tell you about how to arrange a no charge phone consultation to talk with me personally about any health concerns that you may have. So, let's get started. Um, I just wanted to talk a little bit about, I think, what made me who I am today, and also, how I ended up where I am. So my interest in medicine really was sparked from a strong desire to help my younger brother who has high functioning autism. And he had kind of a rough start in life. He had constant rounds of ear infections and antibiotics from the time that he was about 6 months until 18 months. So he was just constantly on antibiotics. And he had no words until he didn't start babbling until about age 3 and didn't have any words until age 4. And I'm happy to say that he has made a lot of progress over the years. He earned his Eagle Scout Award. He graduated from high school with a diploma, and he completed a certificate at Windward Community College. And he's been working at a local diner for over 10 years, almost 15 years now. So I'm definitely proud of him and all the progress that he's made, but it's definitely been a journey. And from the time I was a young child, I was absolutely just intent on understanding autism and finding ways to be able to help him. And so from the time that I was in elementary school all the way up to college, anytime I had a project that I was given, if I could choose the topic, I was always trying to find some way to relate it back to autism and to him. And from the time that I was young, from in elementary school, I knew that I wanted to be able to work with my brother and kids like him and to be able to help them. And as I learned more about the medical causes of autism, I decided to go into the medical profession to help children with underlying causes of special needs, because there is a lot of research that's come out finding that there are definitely medical causes that can be underlying the symptoms of autism as well as other special needs. So from there, I attended the National University of Natural Medicine in Portland, Oregon. It's the oldest accredited naturopathic medical university in the country. And I actually have two medical degrees. One is in naturopathic medicine, and the other is a master's degree in oriental medicine and acupuncture. So I felt it was important to be able to practice acupuncture because it really lets me do so much more for my patients. And I think it really expands the scope of my perspective in terms of seeing both Eastern and Western medicine. I also completed training with the Autism Research Institute and the Medical Academy of Pediatric Special Needs. And that's a group that trains physicians, so MDs, medical doctors, osteopathic doctors, naturopathic doctors, chiropractic doctors, trains physicians in the latest medical research and treatments for autism. And now I not only treat children on the autism spectrum, but I also enjoy helping people with many other conditions, from digestive problems to autoimmune disorders to women's health concerns. And there's many other conditions that I see. So I really fell in love with naturopathic medicine as I learned about the philosophy behind it and the whole approach to working with patients. And so I wanted to go through, there are 6 principles of naturopathic medicine, and I just wanted to go through some of those principles with you. So the first principle of naturopathic medicine is the same as with other types of medicine, which is first do no harm. So we want to utilize the most natural, the least invasive, and least toxic remedies as possible. And so I think every other healing profession has that oath to first do no harm. But I think often there are a lot of instances where, especially in conventional medicine, sometimes there tends to be a tendency to just kind of jump to drugs because that's really the mainstay of the treatments that are given. And there's not that many other tools in the toolbox. And so, for example, I see many children who get middle ear infections. And there's many cases actually of ear infections in children that are actually viral, that are not caused by bacteria. But the mainstay of treatment is to give oral antibiotics. And many people in the United States are surprised to learn that that's not the standard of care in other countries. That in other countries, they will often wait and will really try to avoid giving oral antibiotics unless there are complications or it's really severe, and it's not just the knee-jerk first prescription that's given. If a child has an ear infection, very often here in the United States, it's kind of just the first thing, like, oh, your child has an ear infection, okay, give them oral antibiotics. But that may not be what they actually need if it's viral. And there also is research finding that with uncomplicated, simple ear infections in children, that many times those ear infections will resolve on their own without any intervention, including antibiotics. They'll often resolve on their own within 7 to 10 days. And so by the time that a child is sick and the parents notice, okay, they have symptoms, and then they take them to the pediatrician, by the time they're able to get in to see the pediatrician, it's usually a few days along already. And then when they start the antibiotics is usually around the time that most ear infections would resolve on their own by themselves without any intervention. And so the research is finding that that's not something that's really that needed, but that's just one example of, kind of jumping to treatments that may not necessarily be needed. And in terms of doing no harm, I mean, oral antibiotics, what harm can it do? Well, there are studies finding that antibiotics, even a single dose of antibiotics, a single course of antibiotics, can permanently change the gut flora, the good gut bacteria in our intestines. And we now know that the gut bacteria are linked to a number of different conditions. So if there's an imbalance in the gut bacteria, that can predispose someone to yeast infections, and is also important for regulating the immune system, and also a number of other things. And so if the gut flora is imbalanced, then that could actually predispose to having more problems with the immune system. So that's one example of that. Another tenet of naturopathic medicine is the healing power of nature. And so trusting in the body's inherent wisdom to heal itself and doing everything that we can to support the body's own ability to heal. So for example, with colds and things like that, I will give herbs usually that will help to strengthen the body's immune system. There may be instances, of course, where we may need to give herbs or even antibiotics or things that will kill the bacteria if it's severe enough. But often we do want to try to do everything that we can to support the body's own healing abilities. Another one is to identify and treat the causes. So looking beyond the symptoms and trying to treat the underlying cause. One example of that in conventional medicine is headaches and migraines. So oftentimes, if someone comes into their primary care physician, and if the primary care physician is not trained in holistic medicine or natural medicine, then someone comes in with a headache, and they give them a prescription for an NSAID, which would be things like ibuprofen, or other things that will basically decrease the pain. It will decrease the body's ability to sense the pain. But, what's the underlying cause? Why does the person have a headache? Or with people with migraines, there are strong medications that can be very important, that can help to decrease the pain or get rid of the migraines. But the question still remains, what is causing the migraines? What's the underlying cause? And very often in my practice, I see people who come in with migraines or headaches where it can be due to stress. It can be due to tight muscles in their neck and shoulders, something called a tension headache. Sometimes people can have headaches or migraines that are due to food allergies or sensitivities, or there could be things that they are eating for example, MSG or food dyes or additives or preservatives that are triggering their headaches. Sometimes they're not drinking enough water. Sometimes it can be an autoimmune condition or autoimmune disease where their immune system is attacking their own body. Sometimes it can be due to not enough sleep. And so when I have patients that come into my office, I'll usually sit down with them and do a really thorough intake, and I'll ask about their diet, I'll ask about their lifestyle, about their water intake, about the foods that they're eating, about their stress levels, and really try to do this so I can get a broad range in terms of seeing what could be the potential triggers or what could be the potential underlying causes. So that's something that I think is really important that should be addressed in really trying to figure out what's the underlying cause. And until we figure out the underlying cause, and we can't really adequately and effectively address that concern or keep it from coming back. So, for example, when people have headaches or migraines, then I'll try to figure out what the underlying cause is and try to do everything we can to address that. So if it's stress, I might recommend meditation or breathing techniques. I may do acupuncture. If it's due to hormonal imbalances, then I'll use herbs and homeopathic medicines to try to balance the hormones. If it's due to not enough water or not enough sleep, then of course I'll recommend those things. If it's due to something like an autoimmune disease, then we try to do things to regulate the immune system and to keep the immune system from attacking their own body. Sometimes headaches are due, like I said, to food allergies or sensitivities. So I'll test for those and then recommend, if we see things that come up on the test, I'll recommend taking those out. Sometimes people have headaches that are due to toxins in the body, like heavy metals, like mercury or lead or arsenic. And so then we need to work on detoxing the body and to get those heavy metals out. And there's an analogy that I give that, for example, if the oil light came on in your car, and so then you said, okay, oil is low. So you take it into the shop, and then afterwards you pick up your car and they say, okay, problem's fixed. And you tell them, okay, what kind of oil did you put in the car? And say, oh, no, we didn't put oil in the car. We cut the wire to the light. So the light is off. So the problem is fixed. The oil light is off. Problem is fixed, right? And I mean, as ludicrous as that sounds, right, that unfortunately is often the case of how many things are treated in conventional medicine, that we will basically just give something to decrease the body's ability to sense pain, but that pain is still there, and the pain is a symptom of something. Just like when the oil light comes on in your car, it's a symptom that the oil is low, and so you need to address the underlying cause. And that obviously cutting the wire to the oil light is not going to fix the real problem, right? It's the same that I find in autism, for example. There are many different medical conditions that research has found that will underlying cause symptoms of autism. So if a child is aggressive, very often it's due to some kind of pain in the body. Like they may have acid reflux, or they may have inflammation in their intestines, or they may have headaches, and they just don't have the language to be able to tell us that, to tell their parents, my tummy hurts or my head hurts. And so then they get aggressive, or they're banging their head on the wall. Many children are nonverbal or have very little language, and we find that often is due to certain nutrient deficiencies. There is a condition called cerebral folate deficiency, which is a deficiency of folate in the brain. And there is an autoimmune condition, meaning that the immune system is making a protein that's blocking folate from getting into their brain, and that can be treated with a specific form of folic acid called folinic acid. But those are just some examples of really doing kind of investigative medical detective work to figure out what is the underlying cause behind that. Another tenet of naturopathic medicine is the doctor as teacher. So that the physician really is an educator and has the responsibility to sit down with their patients and to educate them about what's going on in their body, about what this or that herb or medicine will do, and how that they can take a proactive approach in being their own health advocate and creating wellness for themselves, changing their diet or other kinds of things, for example. Another tenet of naturopathic medicine is treating the whole person. And so really looking at the whole person. So, we are all, of course, one whole, and our emotions can definitely be tied into our physical body. So that's one thing. And another thing is that we are not just a thyroid gland or a stomach or an intestine or a heart. We're a whole person, right? And all of those things are interrelated. And I have a lot of people that come in to me and say, I have problems with my thyroid. I have problems with my gut. I have stomach pain. I have headaches all the time. And I also am really tired all the time. And, I get all these different medications for all these things. I get levothyroxine for my thyroid, and I get ibuprofen for my stomach pain and for my headaches, and I get a migraine medication, and for my being tired, they just say, oh, sleep more. But the thing is that all of those things can definitely be interrelated. And so it's really about seeing the whole picture and about how all of those different conditions can be tied into each other. And that when we figure out the underlying cause, then we're able to really effectively treat all of those things. So that's another example. One thing is that when I am working with my patients, in order to effectively have the time that I need to take a very thorough history and to be able to treat the whole person and see all the interrelationships between all the different systems, and to be able to have the time to educate them about what's going on, I really need a longer period of time than a conventional doctor. So my new patient office visit is an hour and a half, where most of that time is directly one-on-one, where I'm working and talking directly with the patient. And then my follow-ups are an hour long, because we really need that time to be able to do a thorough history and to be able to really figure out what's going on with the person and what's the underlying cause. And there's a pretty big contrast from most standard doctor visits that are, 5, 10, maybe 15 minutes at the longest. So that's another big part of naturopathic medicine. And prevention. So really focusing on preventing future conditions and future symptoms, looking at overall health and wellness and disease prevention. So I often will do a lot of screening tests. A common one that I do is vitamin D. And vitamin D deficiency has been associated with a number of conditions. It's been associated with increased risk of heart disease, of depression, anxiety, cancer, autoimmune diseases. And so that's a simple thing that I can do in testing for vitamin D levels, so that if someone is deficient, we can correct that deficiency and potentially reduce the risk for them developing all these conditions later in life. So that's one example. There are many other things that we do, but that's one simple example in terms of prevention. Also, I'd like to talk a little bit about what acupuncture can do. Most people think about acupuncture as just treating back pain or neck pain and things like that. And it definitely can work for that. But many people don't realize that acupuncture can actually treat a lot of other conditions and very effectively. So I use acupuncture for a number of other conditions. I use acupuncture and find it very, very helpful for PMS, for menstrual cramps, for headaches, for depression, anxiety. There's a number of other conditions that I find just besides back pain and neck pain that it can be very helpful for. And acupuncture is another way that it's working on the whole person, because with acupuncture, we're trying to find where the levels of energy are deficient in the body, where there might not be enough energy in certain areas of the body. And in other areas, there may actually be energy that is stuck, that's not flowing very well. And so acupuncture is working on a very basic level. It's working to help open up areas where there may be stuck energy or poor circulation, and helping that to start to work well again. And on another level, if there are areas where there's not enough energy in the body, then there are other types of techniques we use with acupuncture to be able to help to strengthen the chi or the energy in the body. And I have a lot of people who are needle phobic too, and they should also know that acupressure can sometimes be very helpful too. So if you're needle phobic, then acupressure can sometimes be just as effective. With acupressure, basically, I'm just using my thumbs or my fingers to just press on the points. And often I'll press on them and use essential oils in some of the different points. But that's something that can often be very helpful as well. And then some people ask, well, how do you kind of reconcile these two worlds with like naturopathic medicine and Chinese medicine, like Eastern and Western? Because naturopathic medicine, while it is holistic and natural medicine, it still is definitely based in Western medicine and science, and with lab tests and doing physical exams and all these kinds of evidence-based things. And Chinese medicine does have an evidence base, but it's typically thought of as something that is a little bit less based on Western medicine and science. There definitely are a number of studies with acupuncture finding that if you use acupuncture, that it can help with circulation, that it releases endorphins and other types of things to help in terms of a number of other symptoms. So there's definitely some good science in terms of acupuncture. But I found that the combination is very, very helpful because I can order labs if I need to, or understand medications that people are on. As naturopathic physicians, are trained in primary care medicine, so we can do, we can prescribe medications, pharmaceutical medications if we need to, and understanding the mechanism of action, understanding the science behind it, and how it may interact with other medications or with other herbs. So that is very helpful. And if I need to prescribe a pharmaceutical medication, I can, but I definitely will try as much as possible to use more natural remedies. And then when I do acupuncture, then I can complement what I'm doing with diet and lifestyle and supplement recommendations like herbs or homeopathy, and be able to do acupuncture. Also use Chinese herbs, and those can be helpful as well. And so that's one of the things, that I find really helpful in terms of harmonizing those two and bringing it back together. And just to let you know, I'll be wrapping up pretty soon, and I'll be telling you about how to arrange a no-charge phone consultation to talk with me personally about any health concerns that you may have. I also wanted to mention that I have some strong beliefs about practicing medicine. So I believe that prevention is preferable to treatment. That if you can prevent things, that's going to be a lot more effective than trying to treat it later on down the road. I also believe that many of today's conditions are preventable, and that is something that can be done. I believe I have a responsibility to educate both my patients and the community, and I believe in empowering patients to become successful stewards in their own health. And this comes, this all kind of comes together in my practice. My upbringing, my passion for treating autism, my education and training, my beliefs is our Partnership for Health program. And the Partnership for Health, it provides ongoing treatment programs that combine medical treatment with education and support. And all of the programs and policies in our practice are centered around my core beliefs. In fact, that's why I have this Facebook page and why I'm doing these Facebook Live events, to really help educate and empower the community. Another thing I wanted to share with you was our mission statement. So this here is our mission statement here at our office, and it talks about our mission. So I just want to show this to you. So our mission here, it has several different things of our beliefs. So that we are here to heal, we are here to educate, and that we are here to empower. And then that is very important for all of my patients: healing, educating, and empowering. And then that's something that I really believe that's how medicine should be practiced. And I wish it was like that for all doctors. And that's one of the reasons that I'm trying to help educate and empower the community, because if there's more consumer demand for natural medicine and for having more holistic medicine and better patient care, then that's something that the medical community eventually will respond to. So I want to thank you for being here. I appreciate the opportunity to share a bit about myself and my practice. I hope you've enjoyed it. If you would like to arrange a personal no-charge phone consultation, it's really easy. Just call our office at 808-783-0361, and you'll also find the contact information on our Facebook page. So I want to thank you again for joining in, and aloha. I also want to mention one more thing. I am part of the Kili'i Foundation. We're a nonprofit organization that is focused on helping families with special needs. And the Kili'i Foundation is having a free event for special needs families on this coming Saturday, July 21st. It's going to be at Kahumana Farms out in Waianae, and we'll be posting some information about the event too. So it's a great event. There's free a lot of free snacks, and there's pony rides and bouncers and all kinds of cool things. And there's going to be some great seminars and some great information for parents to help educate and empower you for your special needs children. So I hope that you'll be able to attend the event. And again, thank you for joining us. We'll see you at our next Facebook Live event in 2 weeks. Aloha.